Hi, Dr. Happy here. If you are taking medication for any health issues continuously, please do share the details with the dentist so that we can identify the risk factors while doing the dental procedure as well as the drug interactions while prescribing the antibiotics. We are in a world where the diabetes and cardiac problems are at the higher side. So, if you are having diabetes or hypertension, the doctor may advise you to take some blood thinners or anticoagulant to be on the safer side, because these drugs will reduce or eliminate the formation of blood clot, so that you will be safe. You are at a high risk of cardiac problems. So, while taking these medications, you will be safer side. You will be on the safer side. So, if you are taking these medications, please do inform the dentist, like medications like aspirin, ecosprin, Plavix, heparin, warfarin, because these medications will make your blood thin, as well as it will reduce or eliminate the formation of the blood clot. So, it may cause increased bleeding while doing the procedure as well as post-operatively. So, if you inform the dentist will plan accordingly. He will check your history, and the doctor may advise you to stop the medication 3 days before the procedure, and maybe if it requires post-operative too. So that the risk of bleeding will get reduced. And as well as the diabetes patients, if you are not under control, there are high risk of infection. So there may be delayed wound healing will be there, and there are dry sockets. All these are the post-operative complications. So to avoid this, we may advise you to take some antibiotic period to the procedures like dental extraction or any surgical procedures, to avoid the post-operative complications like delayed wound healing and post-operative infections. And some of the patients may receive like immunosuppressants, that is usually given in the rheumatoid arthritis, autoimmune disease, psoriasis, and Addison's disease, and in organ transplant. It's like immunosuppressants, it's a steroid like prednisolone or hydrocortisone. The doctor may advise you to take for prolonged time. So in such cases, the endogenous steroid secretion will get reduced. So because of that, you cannot withstand the stress. As well as the immunosuppressants will suppress your immunity, so that you will be at the higher risk of infection. So in such cases, we may advise you to take the antibiotics prior to the procedure. And as well as if you are taking the steroids for prolonged time, we may advise you to double the dose 1 hour before the procedure, and in some cases, if it requires, even the post-operative. So, please understand the risk of these medications you are taking, and inform the dentist, because most of the patients used to think like, why I have to share all these details to a dentist? They are working only on the oral cavity. No, even we are working on the oral cavity. The medications you are taking have lot of drug interactions with the medications we prescribe, as well as the health issues that have a close relationship with the oral cavity, as well as we are doing some surgical procedures. So it's related to your whole health condition. So please do inform your health problems, underlying any health issues, diagnose health issues, as well as you are taking any medication continuously, to be on the safer side. Always openly share with the dentist, so that we can plan accordingly the dental procedures. We can schedule it accordingly, and if we need to alter the medications, we can do that. If we need to get a physician concern, we can do that, so that you can have a smoother surgical procedure, as well as you can have a healthy, happy life. Thank you.